Hello there! If you have an older cat at home, this explainer is definitely for you. We're going to talk about one of the most common things they can face, and my goal here is to make it all feel clear, understandable, and hopefully a lot less scary. You know, it's a classic story I hear from cat owners all the time. Their senior cat, who used to be pretty calm, is suddenly starving, eating everything they can get their paws on, drinking tons of water, but they just keep getting thinner. It's confusing, and frankly, it's pretty concerning. If that sounds at all familiar, you're in the right place. We're about to dig into the most likely reason for this, a condition called hyperthyroidism. So, what in the world is actually happening inside your cat's body? Well, to get it, we need to talk about a tiny but really powerful set of glands in their neck. At its heart, hyperthyroidism is exactly what it sounds like. Hyper means overactive, and thyroidism is all about the thyroid gland. These two little glands, one on each side of the windpipe, just go into overdrive. They start pumping out way too much thyroid hormone. And since that hormone is kind of like the body's gas pedal, well, when there's too much of it, everything starts running way too fast. Yeah, this analogy of an internal motor stuck in overdrive, it's really the perfect way to picture what's going on. Just imagine a car where the accelerator is pushed to the floor all the time. That's what's happening inside a hyperthyroid cat. They're just burning through fuel and energy at a rate that the body just can't keep up with. So who are we talking about here? Well, this is overwhelmingly a disease that affects older cats. The average age when we find it is right around 12 or 13 years old. And here's a really important and reassuring point. In about 98% of these cases, the cause is a benign, non-cancerous growth. It means the gland is overactive, sure, but it's very rarely something malignant. All right, let's talk about the signs you can actually see at home. As a cat owner, you are the #1 expert on your cat's normal behavior. You're in the best position to notice when things change, and what you see is the critical first step. When we look at the clinical signs, a really clear pattern emerges. The top two are the real calling cards of this disease. Weight loss, which we see in a whopping 88% of cats, paired with a massive increase in appetite. It's that classic contradiction we started with. Other common signs are things like vomiting, drinking a lot more water, and this new, almost frantic energy. So what does all that clinical stuff actually look like in your living room? It means your cat might be waking you up at 3 a.m., yowling for food. It might mean they're suddenly zipping around the house like a kitten again, or they just seem agitated. And you might notice their coat, which used to be perfect, now looks kind of scruffy. Maybe because they're just too revved up to take the time to groom properly. These are the real-world clues. Okay, so once you've spotted these signs, the next stop is your veterinarian. And I've got good news for you here. Diagnosing hyperthyroidism is almost always very straightforward. Here's what you can expect. Your vet's going to do a full physical exam, and often they can actually feel that little enlarged gland in your cat's neck. But the real key is a simple blood test that measures a hormone called T4. If that T4 level is high and your cat is showing all those classic signs you've been noticing, well, that's our confirmation. Now, let's get to the most important part. What can we do about it? And I want to be perfectly clear here. This condition is very treatable, and the outlook is generally excellent. There is a whole lot of hope. There are 4 main ways we can go, and they really fall into 2 simple categories. The ones that control the disease and the ones that can actually cure it. Let's break them down. First up is medication, usually a drug called Methimazole. This is a very common approach. It works by stopping the thyroid from producing too much hormone. Now, it's not a cure. It has to be given every day for the rest of your cat's life, but it is fantastic at managing the symptoms and getting things back under control. Next is what many of us consider the gold standard, radioactive iodine. Now, I know that name sounds a little intimidating, but it's an incredibly safe and targeted treatment. It's a one-time injection that zaps only the abnormal, overactive thyroid tissue. It's amazing. It cures the disease completely in the vast majority of cats, with no need for daily pills or surgery. Surgery to actually remove the overactive gland is also a cure, and it has a very high success rate. The main thing to consider here is that it does require general anesthesia, and that always carries some level of risk, especially for an older cat who might have some other things going on. And finally, there's a dietary option. This is a special prescription food that's made with extremely low levels of iodine, which is the key ingredient the thyroid needs to make its hormone. But here's the catch, and it's a big one. For this to work, it has to be the only thing your cat eats. I mean nothing else. No treats, no people food, no catching mice. It takes total commitment. I just want to circle back to this number for a second. Over 95%. That's the cure rate for radioactive iodine. That's a powerful number. It represents thousands and thousands of cats getting their health and their comfort back. So, the bottom line is this. No matter which path you and your veterinarian decide is best, the outlook is really, really good. With the right therapy, that internal engine that's been stuck in overdrive can be brought right back down to a normal, healthy idle. Your cat can put that weight back on, their frantic energy will calm down, and they can go on to live a wonderful, happy life. If you take just one thing away today, let it be this. You are your cat's most important health advocate. Your observations are what start the whole process, and your partnership with your vet is what makes a solution possible. This is a common and serious condition, for sure, but it is absolutely manageable. Remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.